Welcome to Health Facts with Normani Ricks. I am your host, Normani Ricks. I like to start off each episode with a little known health fact. Did you know that PCOS recently was renamed PMOS? This is a condition that causes irregular menstrual cycles, weight gain, excess hair growth, and acne and infertility. I have the honor of having Tarsha Calhoun with us on the show today. Ms. Calhoun is a registered nurse and the founder of Eat the Weight. She helps those who are struggling with weight, low energy, and blood sugar. Welcome to the show, Tarsha.
Thank you. Thank you, Dr. Norman, for having me here.
How you doing?
I am phenomenal. How are you doing?
Great, 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 great. So, can you tell us some about your journey? So, how did you get into weight management and becoming a nurse and all of those things?
I love that question. Absolutely. Always when I hear that question, I think about, okay, where do I start this journey from? Because it goes way back. So I'm going to speed it up. But how I got into nursing, originally, I wanted to become a pharmacist. That was my goal. That was my dream. And I actually went to school for pharmacy.
Okay.
But my youngest sister had a brain aneurysm. Yeah. Didn't know why she was having all the headaches. And so went to the doctor. She was going to the doctor several times. They were treating her for migraines. And then this particular time, they said, look, we have to do emergency surgery. So they flew in the specialist. And I just remember the doctor saying, it wasn't looking good. It's a possibility if she did survive the surgery that she wouldn't be able to walk, talk, all of these things that you don't want to hear. And I was 20 at the time, 19 or 20. So I just remember how well the nursing staff and the doctors, how comforting they were during that time. And she did survive the surgery. Not only did she survive the surgery, she actually walked out of the hospital. So just a miracle. I want to be that from another family that's going through. And that's how I led. So I transferred into Grambling State University. At that time was the #1 nursing program in the U.S. And I became a nurse. Awesome. And that's how that journey started. Now, how it morphed into either way the weight and helping people, because during that time of my nursing, I would see people just down and out. And they would get the diagnosis of high blood pressure, high cholesterol, or diabetes. And I think it was a death sentence. And I was like, no, it's not. A lot of times it's just lifestyle modification, or the doctor would come in or the provider would come in and say, if you don't make these changes, the outcome is possibly death. Nobody would change. It did nothing. And the last thing I was noticing was about health, losing weight. You go to your provider, and at that time it was just eat less and move more. So they leave with the prescription, and then you're thinking, well, what does that mean? Mm-hmm. So that's where all of this came from. And I wanted to show people like, yes, one thing I've learned is that people know what to do, but there was a disconnect between doing it and being sustaining it, knowing what to do and doing it and then making it sustainable. So that's where it comes from. Lifestyle modification, learning to work with your body and not against your body.
So where do you think that most people have the problems? Do you think that it's probably like the way they were raised, the types of food they ate growing up? They don't really know like how to get away from those certain foods. Like, what do you think it is?
That's a great question. I think it's a combination. I really do think it's a combination. And another reason why I always start my clients with doing a personal assessment. Me personally, I know, I grew up in a household where you ate all your food on your plate. It didn't matter if you was full, you better eat your food, because if not, something was waiting on you. And then I was always one who was thinking and just never would go along with the nonsense. Mm-hmm. And I know my parents would say, there are people starving in Africa.
Right.
And I would think, well, if I eat it, it's still not happening. So I think that's part of it, some of the upbringing. And then in addition to that, just the fast pace of our lives. We're always on the go. And then another thing is, I believe plays a part in, and I see it a lot with different clients I work with, it's too much knowledge, too much information, not knowing what works for their body. It's nothing wrong with the information, the resources. We have resources galore, but knowing what works for my body. So I think that's where it started, knowing what works for them and then being able to silence all the other noise and not saying right or wrong, but what's beneficial to me.
So I did read that you help men and women, but I want to particularly ask you about women and their struggles with menopause, perimenopause, those types of things where it's like you try and you try and you try and you're like, what is wrong with my body? Like, why can't I lose this weight no matter what I do? So if you can talk some about like metabolic disorders, insulin, thyroid, and all those things that affect women.
Yes. Want to pause because you just said something. And that's one of the reasons why I love women over 40. One, we have lived, we have experienced life.
Mhm.
And this is a time, 40 plus, they don't really I don't want to say they don't educate us. It's one of those things where you don't know it. You've heard your parents or, other women talk about it, but it's one of those things you have to experience and it hits you like, whoa, what is going on here? So to speak to that, I always start with stress, going back to that assessment. That's why being honest with yourself, what is going on with me? I definitely, would say go to the provider, have them run labs before. One of the things I notice with clients and people I talk to and work with, they like to just throw a bunch of stuff. As great as social media is, sometimes I cringe when people talk about this work for me or, promoting this product. So then they have all of these vitamins, all of these minerals and all of this stuff when that's not necessarily what your body needs. So being able to listen to your body. So going back to the menopause and perimenopause and things of that nature, getting quiet, silencing, going within. And I always ask, how do I honor my body? What are you saying to me? Looking at those cues. For me personally, my journey has been, I was having night sweats, my own personal heater. I would be extremely hot, then extremely cold, the night sweats, the fatigue. And I thought something was wrong with me. And I did go to the provider, asked to run labs, but I didn't think they ran the full, hormones. So I went on my own and had it done. But I was talking to a good friend of mine and she said, Tarsha, what are you eating? Tracing it back to some of the things that I was eating. So I cleaned up my diet. One of the things that I love was pizza. I became gluten-free on a lot of things, but I didn't even Greek yogurt. So some things that we deem as healthy may not be healthy for our body. So what works for someone else may not necessarily work for you. So now that I notice that I don't eat a lot of dairy products and I'm not lactose intolerant, because that's why I was like, I'm not lactose intolerant, but it was just certain dairy products, staying away from pizza, something in pizza. It doesn't matter if it's the healthiest form or the non-healthy. It does something. So looking at our diet, but really honing in on how does this affect me? What is going on with my body? Paying attention to everything, even little things such as how we respond or how we react to certain people or certain situation. All of that makes a difference. So just knowing what works for you, really going.
No, you said some great things there. So I think that can go back to trying to keep a food journal or a food diary and just trying to remember what made you feel bad or what made you swell up. Or if you're a person that gets on the scale, what made you gain 2 pounds overnight? Like, so start paying attention to that types of things. Also, how important do you think water intake is for weight management?
I love the question. Honestly, I'm searching for the word, but I don't think there's a word in the English language that adequately describes how important hydration is.
Okay.
And I'm going to say hydration simply because water is important, but sometimes when we say water, people will say, oh, I don't really like water. So it doesn't matter. Intake, because we have a lot of food that's high in water content.
Okay.
And it's very important considering the fact our body it's what, 80, it depends, men and women, I forgot all of the sex, 60 to 80% water.
Yes.
So we need it. We have to replenish it, especially during the heat, in the summertime when we're sweating a lot. And not only just water, the quality of water. Quality of water matters, whether it be spring, purified, like I say, eating foods high in water content, coconut water. And I'm going to put a disclaimer out there. You got to watch it if you have kidney issues and things like that. But just hydrating our body. Our body needs that. The blood needs it. Our organs need it. So to answer your question, it's extremely important. I would rather someone start with hydration than start cleaning up their food. Start cleaning up their eating habits. Start with hydration first. And really quick, I want to throw this out there, if I may, just a little challenge, because sometimes I don't know if you're like me or anyone listening was like me. I just knew I was drinking water. So I set the timer for an hour. And with every hour on the hour for about 8 hours that day, 8 to 10 hours. And every time the timer would go off, I wrote down how many glasses of water, what type of water I consumed, or, if I consumed something, water or food. And to my surprise, I wasn't drinking water. I was drinking a lot of juice.
Wow.
So that if you think you're hydrating well enough, that's a great challenge to do for yourself. And, just become clear. Awareness is everything. So just to reiterate, hydration, drinking water is extremely important. And you would notice a difference. Everyone would notice a difference when we're hydrated. Our skin looks better, it starts to glow. The lips, we're not crusty. You just feel better. And we talk about anyone who having joint pain, a lot of times it's because we're dehydrated. Dehydrated is a real thing. And when you look up symptoms of dehydration, the list goes on. There's a plethora of symptoms. And a lot of times it just traces back to dehydration. And we don't want to have to go into the hospital to be hydrated when there's something that we can do ourselves.
Wow, that is super, super informative. Another hot topic that's going on right now is the PCOS and PMOS. So can you touch on why they changed the name?
That's a good question.
Okay.
I'm not really sure.
Okay.
I have to look into it.
Okay.
But just thinking about that, I'm curious as to why they do a lot of different things. Mm-hmm. So I won't give my own personal opinion without really looking into it, because it may not be the best opinion because it is strictly personal.
Well, I think that it's very interesting because it's called polycystic ovarian syndrome. And I think they usually diagnose it with an ultrasound and you may have cysts. But I think from what people were saying online is kind of misleading because PCOS is a lot of different things, whereas you have so many different symptoms and not just cystic ovaries. So it really affects women in so many ways, with infertility, with acne, with hair on their chin, those types of things. So I feel like a lot of women that I have spoken to that have PCOS, they did not feel heard or listened to. So maybe that's why they changed it, to try to make people feel more understood.
Yeah. I like that you said that. And just to expand on that, I was kind of, I started thinking about, okay, what's the root cause here? Changing it, are women still going to feel heard? Does that change the actual problem at hand, the issue at hand? Mm-hmm. Or does it just group everything together once again to give people a diagnosis and just throw a bunch of medicine at it? Or, yeah.
Do you think that GLP-1s are helping people with PCOS?
So I think so. However, I think there's a lot of education that still needs to be done around GLP-1s. It's not the end all be all. It's not the solution for everything. And the fact that it's been around for ages, our body is a natural hormone in our body. But yes, it does help. But with that, there's some other things that need to be looked at. And I don't think that there's enough education around the other things, such as what the GLP-1 does for the body, and then what a person needs to do to help maximize the tool that it is. Because it's just that it's a tool. It's a great tool. It helps with just recently they approved it for sleep apnea.
Wow.
Like it does a lot. And when you think about it, Dr. Normani, if something helps decrease your appetite, so now, and it decreases the food noise, it goes back to what? Fasting. It's the same thing that happens with fasting. It just now the person doesn't have the food noise, so they're not constantly hungry. They're not craving things. So the body has a chance. It gives the liver, the pancreas, and, won't get too clinical with it. But, it just blows my mind when people say, oh, yes, because your body is now fasting. It's in a fasting state for the most part.
That's a great point. I never thought of it like that, because I know that a lot of people will recommend it like intermittent fasting, but I never thought of how like GLP-1s can automatically put you into a fasting state. So that's pretty cool to think about. I've also read about GLP-2s, GLP-3s. I don't know when all this stuff is going to be approved. But I mean, I'm happy that, new research is coming out. But like you said, we need to be educated more. And I know there's also with GLP-1s, don't you have to be mindful of the nutrition as well? Maybe like protein or collagen?
Yes.
Okay.
The nutrition piece of it, the lifestyle modification is what makes it sustainable. Okay. It's what maximizes it. So yes, it's going to help. But then you don't want to walk around, have lost a lot of weight, but just look sick with it. You want a healthier metabolism. So it goes back to some of the things that we was doing naturally that, helps you release the weight. Paying attention to what you're eating, as well as hydration is a big deal. Okay. One thing that most people don't think about is bowel movements. A lot of times people become constipated because they're not eating enough fiber. And going back to the water intake, hydration, you got to make sure our bowels are moving, preserving your muscles. Because if you're not eating the protein and thing with the protein, looking at your kidney functions. I have a patient I was working with. She was just upset that she could not take her GLP-1. But I was like, is it really worth? You have one kidney that's barely functioning.
Yeah, it's dangerous.
And that's one of the things, one of the contraindications of it, plus a few other things. So yes, definitely looking at, there's other things that play a major part of your nutrition. Because if your muscles waste away, I don't know, have you seen, you can kind of tell people who are on GLP-1 that's not taken care by their eyes and everything because it's muscles. Right. And you don't want to be so weak, you can't even pick up a pencil. So that's why I think a lot of education needs to be done around it. Okay. And one of the reasons why I love what I do is because of the education piece. Use it as a tool, not the end all be all. Make those changes that's necessary for sustainable weight loss. In addition, not just weight loss, but to have a healthier metabolism. Because that's what it's about. When you have a healthier metabolism, right, weight loss is a byproduct. The vitality and living a long life, that comes with the metabolism, healthier metabolism.
So we spoke a lot about women's health, but I do want to leave our listeners with something that they can take home for men's health. Because I feel like a lot of men just probably don't go to the doctor until they're,
Yes.
No preventative health. It's reactive and not proactive.
Very much so.
So do you have any advice for men?
We'll start right there where you left off. Go get checked out. Do your wellness visit. And the same thing, and it's the same for women. Pay attention to your body. Pay attention to your body. The body talks to us. It whispers. But oftentimes, we don't listen until it's screaming. And I love my men. And I know you guys, it doesn't take away from the man that you are. It doesn't take away from your greatness. It actually adds to it. So definitely have those monthly checkups, the normal checkups that you need. And if you're not feeling good, it doesn't matter what it is, go to the doctor. Please, definitely go see your provider.
All right. Well, it's been a pleasure, and I want to thank you for all your insightful information. Thank you so much for coming on the show.
Thank you for having me. It went by so fast. Thank you.